Warning: 8 medications that can cause severe dementia. Must know risks. Yo, what's up, health nuts? Dr. Mike here, back with Pure to drop some knowledge bombs on you about brain health. Did you know that certain medications you might be popping like candy could actually increase your risk of severe dementia? Yeah, you heard that right. While we often trust our meds to keep us going, some of them could be messing with our brain power in the long run. Now, before you flush all your pills down the toilet, this isn't about scaring you away from modern medicine. It's about arming you with the knowledge to make informed decisions about your health. Knowing the potential risks associated with certain medications and understanding how to manage them could be the key to keeping your memory sharp as a tack. So today, we're diving deep into 8 common medications that could be silently affecting your cognitive health. Buckle up, Buttercup, and get ready to take some notes. Omeprazole, the heartburn remedy that could backfire. Omeprazole, also known as Prilosec, is a proton pump inhibitor. It shuts down acid pumps, giving relief from heartburn, but long-term use has been linked to an increased risk of dementia. Studies suggest memory fog after 3 years. Talk to your doctor about managing your heartburn. Anticholinergics, the sneaky memory thieves. Next up, we're tackling anticholinergics, a group of medications that are prescribed for a whole bunch of different conditions. We're talking allergies, depression, overactive bladder, you name it. These meds work by blocking a neurotransmitter called acetylcholine, which is basically the brain's messenger boy. Acetylcholine plays a crucial role in memory and learning, so when you block it, things can get a little fuzzy upstairs. Long-term use of these meds has been linked to a higher risk of developing dementia, and we're not talking about a small increase either. We're talking about a potential risk increase of up to 54%. Some common culprits include first-generation antihistamines like diphenhydramine, Benadryl, anyone? Certain antidepressants like amitriptyline, and medications used to treat overactive bladder, such as oxybutynin. If you're taking any of these medications, don't panic and stop cold turkey. Instead, talk to your healthcare provider about your concerns. They can help you weigh the risks and benefits and explore potential alternatives. Corticosteroids mimic the effects of cortisol in the body, and while that's great for taming inflammation, long-term exposure to high levels of cortisol can actually damage neurons in the hippocampus, the part of our brain responsible for memory and learning. They can help you find the lowest effective dose and explore other options to manage your condition. Remember, folks, it's all about finding that balance between managing your symptoms and protecting your precious brain power. Let's talk about benzodiazepines, those little pills that promise to melt away anxiety and lull you into a peaceful slumber. While benzodiazepines can be effective for short-term relief, long-term use has been linked to some pretty serious cognitive side effects, including an increased risk of developing Alzheimer's disease. We're talking about medications like alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan, all popular choices for anxiety and insomnia. These meds work by slowing down brain activity, which, while great for calming anxiety, can backfire in the long run. Imagine your brain as a car engine. Benzodiazepines are like putting the car in park. It's a good idea if you need to stop for a minute, but if you leave it in park for too long, the engine's going to start sputtering. Long-term use of benzodiazepines can lead to memory problems, difficulty concentrating, and even disorientation. If you're concerned about your benzodiazepine use, talk to your doctor. They can help you gradually reduce your dose or explore alternative treatments for anxiety and insomnia. Let's talk about amphetamines, the go-to medications for ADHD. These little guys work by increasing certain neurotransmitters in the brain, like dopamine and norepinephrine, which can help improve focus, attention, and impulse control. For people with ADHD, amphetamines can be life-changing, allowing them to function at their best. But here's the thing, long-term use of amphetamines can have some downsides, particularly when it comes to cognitive function. Over time, this can lead to a decrease in your brain's natural production of these neurotransmitters, which can result in cognitive challenges, including memory problems and difficulty concentrating. The key here is to work closely with your doctor to monitor your treatment plan and make adjustments as needed. They can help you find the lowest effective dose, explore alternative treatment options, and address any concerns you might have about potential side effects. Allergies. those pesky immune system overreactions that leave us sneezing, sniffling, and itching like crazy. And what's our go-to solution for relief? Antihistamines, of course. But did you know that not all antihistamines are created equal? First-generation antihistamines, like chlorpheniramine, also known as chlortrimeton, and diphenhydramine, or Benadryl, are the OG allergy relievers. These older antihistamines can also cross the blood-brain barrier, which is like the security checkpoint for our brains. And when they get past security, they can start messing with our brain chemistry, particularly by blocking acetylcholine, that all-important neurotransmitter we talked about earlier that's crucial for memory and learning. Long-term use of first-generation antihistamines has been linked to an increased risk of cognitive impairment, including dementia. If you're concerned about the potential cognitive effects of first-generation antihistamines, talk to your doctor about switching to a second-generation option. Tricyclic antidepressants, the mood boosters that could affect your memory. Tricyclic antidepressants, or TCAs, are like the old-school muscle cars of the antidepressant world. They've been around for decades and can be effective for treating depression, but they also come with a higher risk of side effects compared to newer antidepressants. TCAs work by increasing levels of norepinephrine and serotonin in the brain, two neurotransmitters that play a key role in mood regulation. But here's the thing. TCAs also block acetylcholine, that memory superstar we've been talking about throughout this video. And when you block acetylcholine, you can end up with some unwanted cognitive side effects, such as memory problems, difficulty concentrating, and confusion. If you're taking a TCA and are concerned about potential cognitive side effects, talk to your doctor. There are newer antidepressants available, such as selective serotonin reuptake inhibitors, or SSRIs, and serotonin norepinephrine reuptake inhibitors, or SNRIs, that have a lower risk of affecting cognitive function. Let's talk about statins, shall we? These cholesterol-lowering medications are like the unsung heroes of heart health, helping to prevent heart attacks and strokes by lowering those pesky LDL cholesterol levels. But as with any medication, there's always the potential for side effects. And in the case of statins, one of the most talked about side effects is cognitive impairment, particularly memory problems. Some studies have shown a correlation between statin use and memory problems, while others have found no such link. One theory is that statins might interfere with the production of coenzyme Q10, or CoQ10, an antioxidant that plays a vital role in energy production within cells, including brain cells. Another theory is that statins might lower cholesterol levels in the brain too much, which could interfere with the formation and function of synapses, those crucial connections between neurons. If you're taking statins and are experiencing memory problems or other cognitive issues, don't just brush it off. Talk to your doctor. So, there you have it, folks. 8 common medications that could be messing with your memory. Now, before you panic and swear off all medications forever, remember that this video is all about empowering you to make informed decisions about your health. Always consult with your healthcare provider before making any changes to your medication.